Are there similar situations in many other states? Or?
Yes. I mean, the practice of putting people with serious mental illness in solitary confinement is nationwide. But as I mentioned in my comments, more and more states have passed laws banning the practice. There have been a number of lawsuits challenging the practice. Massachusetts is actually one of them. Arizona, California, Indiana, Wisconsin. So actually we are reaching a tipping point where the practice of putting people in solitary confinement with serious mental illness will no longer be the norm in this country. And certainly we know from the decades of research, international human rights standards, and our own federal court cases that this practice is wrong and it's harmful and it needs to stop.
Aren't the prison going to tell us that it's for the safety of the inmates that they're being put into solitary?
Yeah, that is the usual trope that has been trotted out, but quite frankly, where there has been research, and I'll point to the Colorado Department of Corrections, which was a system that had not one but 2 supermax prisons that held thousands of people in solitary confinement, but the state took a hard look at what they were actually doing. Not only did they pass a law that banned the use of solitary confinement on people with serious mental illness, but then they went so far as to adopt the international human rights standards that said no one is going to be placed in solitary confinement for longer than 15 days. Do you know what happened? Better prison safety, fewer staff assaults, fewer prisoner assaults. So when we look at actual data, what we find is that solitary confinement creates unsafe prisons. And it's not so hard to understand why, if you've ever been in one of those units, because solitary confinement literally drives people crazy. It leads to mental health deterioration. So it increases violence levels. Now, correction system around the country started using solitary confinement in the 80s when mass incarceration ramped up, but there was never any empirical evidence that it did anything for prison safety. And the systems that have actually been brave enough to take a look at their data have found that it is contraindicated. It doesn't help anybody. These units are terrible for the people who live there, they are terrible for the people who work there, and they are terrible for public safety. There's no justification for this practice, and it's time for it to end in Rhode Island.
Has the ACLU intervened in other states? Or?
Yes, we actually have an active docket of litigation brought by our affiliates, by the national office, and our partners around the country.
Presently,
yes.
Active case? Could you give us a sense how many states? Or?
So my office alone, we have a statewide case in Arizona, we have a statewide case in Nebraska, we have a case in Pennsylvania, we have a case in a jail in Arizona, we have a case in the Virgin Islands. Almost all of our cases actually, when we deal with mental health issues in systems, we're dealing with solitary confinement.